The symptoms of post-traumatic stress disorder can be broken down into 3 separate clusters. The first cluster are re-experiencing symptoms, such as nightmares and flashbacks, where an individual can feel as if they're actually back in the same situation and that it's occurring all over again. The second cluster are symptoms of avoidance, so avoiding thinking about, talking about, reminders of the traumatic event. The third cluster involve feeling a current sense of threat even though there is no current sense of threat. And this typically occurs through individuals being very aware, on edge, looking around themselves in case of danger, and also being more jumpy, for example, to sudden noises. To be diagnosed with complex post-traumatic stress disorder, an individual will experience the symptoms of post-traumatic stress disorder plus 3 additional clusters of symptoms. The first cluster are difficulties regulating emotions. This can involve individuals being easily upset, for example by things that remind them of the trauma, and having difficulty calming after that. It can also involve individuals having difficulties engaging with emotions and becoming detached or cut off from them in order to deal with them. The second cluster are beliefs of feeling diminished, defeated or worthless, and are often accompanied by feelings of guilt, shame and other negative emotions. The final cluster involves difficulties in establishing and sustaining relationships and in feeling close to other people. In order to be diagnosed with post-traumatic stress disorder or complex post-traumatic stress disorder, the symptoms need to affect the individual, cause distress, and also reduce in their functioning, being impaired to a degree. It's important to remember that although post-traumatic stress disorder and complex post-traumatic stress disorder are diagnoses within their own right, they commonly occur with other conditions as well, such as depression, anxiety, and substance misuse. When we try to help individuals, it's very important that we assess their individual needs and develop a plan with them as to how best to support them and offer and provide the treatment that's indicated.